The pain started on a Tuesday. By Friday I couldn't stand without vomiting. By Sunday I was in the emergency room of Metropolitan General Hospital, where both my parents happened to work. Mom as an ER physician, Dad as chief of internal medicine. "It's just stress," Mom announced to the triage nurse before anyone had even examined me. "Anxiety. She's always been high-strung." I was 27 years old, a software engineer at a tech startup, and I'd never had an anxiety diagnosis in my life. But that didn't matter. The triage nurse nodded, made a note, and bumped me down the priority list. "Dr. Morrison, should we run labs?" a young resident asked, glancing at my vitals. My heart rate was 132. My temperature was 101.8. "Not necessary," Dad said smoothly, appearing beside Mom like they'd choreographed it. "Our daughter tends toward dramatization. We know her history. Just give her some 4 fluids and Zofran. She'll be fine." The resident hesitated, pen hovering over the chart. But her white count from the initial finger stick was. "We're her parents and her physicians," Mom cut in, her voice that particular blend of authority and condescension she'd perfected over 30 years of practice. "We know what she needs." They left me in a curtained bay within 4 drip and instructions to rest. Through the thin fabric I could hear them at the nurse's station. "Real patients need that CT scanner," Dad was saying. "People with actual emergencies. Not our daughter's anxiety attacks." I closed my eyes and tried to breathe through the pain that felt like something inside me was tearing apart. My parents were medical royalty at Metropolitan General. Mom had published research on emergency trauma protocols. Dad had brought the hospital's internal medicine department from near closure to regional recognition. When they spoke, people listened. When they dismissed my symptoms, no one questioned it. This wasn't new. Growing up, my illnesses were always growing pains, or attention-seeking, or stress from school. My brother Kevin's symptoms, though, those were taken seriously. Kevin's headaches meant immediate doctor visits, MRIs, and specialist consultations. My migraines meant I was sent to school with Tylenol and told to toughen up. Kevin became a surgeon, following in their footsteps. I became an engineer, disappointing them by choosing computers over meaningful work. Kevin's accomplishments decorated their office walls. My achievements were met with tight smiles and comments about finally applying yourself. 6 hours into my ER visit, a nurse I didn't recognize appeared. She was older, maybe 60, with kind eyes and calloused hands that spoke of decades in healthcare. "I'm Carol," she said quietly, checking my 4. "I'm covering this section while the other nurses are at lunch. How's your pain?" 8 out of 10, I whispered. "Maybe 9. She frowned, pulling out her tablet to review my chart. Her frown deepened. "You've been here 6 hours with acute abdominal pain, fever, tachycardia, and elevated white count, and they've only given you fluids and anti-nausea medication?" "My parents said it's just anxiety." "Your parents?" Carol's expression shifted to something I couldn't quite read. "Dr. Morrison and Dr. Chin Morrison?" I nodded. She was quiet for a long moment, then took my vitals again manually. "Your heart rate is 145 now. Your temp is 102.3. That's not anxiety, honey. Can you tell them that?" "I can try." But her tone suggested she knew how that would go. Carol disappeared. I heard raised voices outside my curtain, her advocating for proper examination, Mom's clipped responses about family dynamics and complicated history, and trust me, I know my own daughter. Carol came back alone, mouth pressed into a thin line. "I've documented everything in your chart. That's all I can do right now." He squeezed my hand. "I'm sorry." By hour 8 I was drifting in and out of consciousness. The pain had shifted from sharp to a spreading numbness that terrified me more than the agony had. Something was very wrong. Even through the haze I knew that. Kevin appeared around hour 9, still in his surgical scrubs. "Hey sis. Mom said you're having one of your episodes." "Kevin, please. Something's really wrong. I need a CT scan. You need to calm down." He sat on the edge of the bed, using his doctor voice, the one he'd practiced until it was perfect. "You're working yourself into a panic. That's making everything worse. Just breathe and trust the process." "The process is ignoring me. The process is being managed by 2 of the best doctors in this hospital who happen to be your parents." He stood. "I have a surgery in 20 minutes. Try to relax. He left. I stared at the ceiling tiles and counted them to stay conscious. 42 tiles. Fluorescent lights humming. The smell of antiseptic and the distant sound of a code blue being called for someone else. Someone whose emergency was being taken seriously. At hour 10 everything changed. The curtain pulled back and a woman in a white coat entered, her ID badge reading, Dr. Patricia Reeves, Chief of Surgery. She was tall, black, maybe 50, with an expression that could cut through steel. Ms. Morrison, she said, not asked. I'm Dr. Reeves. I need to examine you. My parents said. I'm not asking your parents. She was already pulling on gloves. Carol Hendricks flagged your case to me directly. She violated protocol to do it, which tells me something's very wrong. Her examination was thorough and professional. When she pressed on my lower right abdomen, I nearly screamed. Rebound tenderness, she said, more to herself than to me. Elevated heart rate, fever, elevated white count. She looked at me directly. Has anyone ordered imaging for you? No. My parents said it's anxiety. Something dangerous flashed across her face. Your parents. Yes. I'm aware. She pulled out her phone and made a call. Get me a CT with contrast immediately. Patient is Morrison. Yes, that Morrison. I don't care what they said. I'm ordering it. Now. He turned back to me. I believe you have appendicitis. Likely a ruptured appendix given your timeline and symptoms. If I'm right, you've been going septic in this ER for 10 hours while your parents told staff to focus on real patients. My vision blurred with tears. Someone believed me. I'm going to fix this, Dr. Reeves said. But I need you to stay conscious for me. Can you do that? I nodded. The CT scan confirmed her diagnosis. Ruptured appendix, peritonitis, early septic shock. I was in the OR within 30 minutes. I woke in recovery to find Dr. Reeves sitting beside my bed, her expression grim. You're going to be okay, she said first. But it was close. Another few hours and we might be having a different conversation. My parents are not here. Her tone could have frozen nitrogen. And before you ask, yes, they know. I called them myself from the OR. Would you like to know what your mother said when I told her you'd had emergency surgery for a ruptured appendix? I wasn't sure I did, but I nodded anyway. She said, well, I suppose she finally got the attention she wanted. Dr. Reeves leaned forward. Ms. Morrison, may I call you Rachel? I've been a surgeon for 28 years. I've seen medical negligence. I've seen malpractice. But I have never seen two physicians actively prevent their own child from receiving appropriate emergency care. They didn't think it was serious. They didn't want it to be serious, she corrected. There's a difference. Your labs were documented. Your vitals were documented. Carol's notes show she advocated for proper examination 3 separate times and was overruled each time by your parents, citing their authority as both physicians and family. He pulled out a tablet. I need your permission to do something. The hospital's medical director is a colleague of mine. This situation, what happened to you, represents a serious ethical violation. Your parents used their positions and authority to prevent appropriate care for a patient. The fact that you're their daughter makes it worse, not better. You want to report them. I want to ensure this never happens to anyone else. Her eyes were fierce. But I need your consent. I need you to understand that this will have consequences. For them. For their reputations. For their positions at this hospital. 10 hours ago I would have said no. I would have protected them, made excuses, taken the blame myself. That's what I'd done my whole life. But 10 hours ago, I'd nearly died because my own parents couldn't see past their dismissal of me as a person. Do it, I said. Dr. Reeves nodded once, sharp and decisive. I'll need your complete medical history. Every time they dismissed your symptoms, minimized your concerns, or prevented you from seeking appropriate care. Over the next 3 days in my hospital room, I documented everything. The childhood migraines that went untreated. The potential broken wrist at age 12 that they'd called a sprain. I still couldn't bend it fully. The severe depression in college that they'd dismissed as drama, refusing to sign off on counseling services. Carol visited daily, adding her own observations from my ER stay. Other nurses came forward too. People who'd witnessed my parents' treatment of me over the years during family events at the hospital, who'd felt uncomfortable but hadn't known what to do. The medical director, Dr. James Chin, reviewed everything personally. I watched his expression grow darker with each page. "This is a pattern," he said finally. "Not just what happened in the ER, but years of medical neglect masked as parental authority." The hospital board convened an emergency ethics review. My parents were placed on administrative leave pending investigation. Kevin tried to visit me once, angry and defensive, insisting I was destroying the family over a misunderstanding. I had security remove him. The local medical board got involved when Dr. Reeves submitted a formal complaint. My case file, all of it including the childhood documentation, went to their licensing review committee. My parents' attorneys tried to frame it as a family dispute, not a medical ethics issue. But the evidence was damning. 10 hours of documented deterioration. 3 separate nurses advocating for intervention. Carol's notes showing she'd been explicitly told to stop questioning doctors when she pushed for proper examination. The recording of Mom's comment about me finally getting attention when told I'd nearly died. The medical board's decision came 8 weeks later. Both of my parents received formal reprimands and were required to complete ethics training. Dad was removed as chief of internal medicine. Mom lost her ER privileges and was reassigned to administrative duties. Their reputations, carefully built over 3 decades, collapsed in the medical community's whisper network. Metropolitan General quietly asked them to resign. They did, taking positions at a small suburban clinic where no one knew the story. Kevin stopped speaking to me entirely, sending one text calling me vindictive and cruel. Dr. Reeves became my surgeon for 2 follow-up procedures to address complications from the delayed treatment. She never charged me for her time. "You did the right thing," she told me at my final post-op appointment. "Not just for you. For every patient whose symptoms get dismissed by medical professionals who think they know better than the person in the bed." Carol retired 6 months later. She sent me a card. "In 35 years of nursing, I broke protocol exactly once. For you. I'd do it again. I still work in tech. I still write code, build systems, solve problems my parents never considered meaningful. But now I also volunteer with patient advocacy groups, helping people document their symptoms and navigate medical systems that don't always listen. My appendix scar reminds me daily that the difference between anxiety and emergency shouldn't depend on whether your family believes you. That medical authority doesn't trump medical evidence. That sometimes the kindest thing someone can do is violate protocol to save your life. The Morrisons still tell anyone who'll listen that I overreacted, that I ruined their careers over a simple miscommunication. They've convinced half the extended family that I'm vindictive, dramatic, attention-seeking, all the words they've used to dismiss me for 27 years. But the medical board's report is public record. The ethics review findings are documented. And somewhere in Metropolitan General's files is Carol's nursing note, flagged with urgent priority that says, "Patient repeatedly dismissed by family physicians despite objective signs of acute emergency. Intervention required." I keep a copy of that note in my desk drawer. Sometimes I read it when I doubt myself, when the old programming kicks in telling me I'm too sensitive, too demanding, too much. Then I remember I survived because one nurse broke the rules. Because one surgeon believed the evidence over the authority. Because I finally said yes when someone asked if they could fight for me. My parents' medical licenses now carry permanent notations about the ethics violations. Their careers will never recover their former prestige. They blame me for destroying what they built. But I'm alive. And that, I've learned, is worth more than their approval ever was.